Just by show of hands, this is new space for us. How many folks feel really, really confident about starting medication use for obesity? I think the rest of us, we're on an early learning curve. The guidelines just came out. That's part of the reason we're here today, beginning to sort of review things. Just by show of hands, would there be any interest in doing sort of a short monthly group phone call and an echo-like project just about medication management, where pediatricians could ask questions about using medication? By show of hands, folks interested? Because we can explore setting that up. You want it, Dr. Fox? Sorry. So we'll take a look at that as well, because we're all on a shared journey together. Remember, part of this is not simply about medication. It's really about engaging families in understanding and change. That's going to be part of our lunchtime presentation, which will be talking about motivational interviewing. And we're doing a lot of work in the behavioral health, the psychiatry space, and we're doing some other projects with behavioral health, and we have a really short segment before lunch with Dr. Beers and Soutullo, who've been sort of coordinating behavioral health work for kids. And they just want to do a very quick update and ask you 2 or 3 quick questions, and then we'll be able to adjourn for lunch and refreshments. Somewhere here is... No?
Thank you, Mark. All right, well, we're getting the slide. There we are. That one. Okay, perfect. Hello, everyone. I'm Lee Beers. This is my colleague and co-lead, Olivia Soutullo. I know we stand between you and lunch, so we truly will keep it brief. I think I was reflecting, sitting in the back of the room, that one of the really beautiful and rewarding things about our profession is the opportunity to really walk with families in managing some of these really complex health issues for themselves and their families. And our topic today is certainly one of those things, but behavioral health is another one of those things. And so we just want to give you a really quick update on the work that we're doing to help support PHN in this area. Again, we've talked with many of you about this before. I think you've all heard this, but really our goal in the Behavioral Health Initiative is to really develop and implement a comprehensive strategy to help all of us address our patients and families' mental and behavioral health needs within the practice network, recognizing there's not a one-size-fits-all solution. Again, one of the great things about this network is the opportunity to work together and learn from each other and use our collective voices and collective experiences to improve care. And that's really our goal in this initiative. So as we've talked with all of you, as we kind of knew things ahead of time, talked with all of you, we really have focused in on 2 key priority areas that we are currently and will be continuing to focus on. The first is training, education, and partnerships. We'll tell you a little bit, you've seen some of that from us, and we'll tell you a little bit more about some of the progress in that area. And then this is you're going to see much more of this in the coming years, but a real focus on integrated behavioral health and care coordination models, and really helping to support practices go further along the continuum in being able to provide those supports and services for patients and families within their practice. And so with that, I'm going to pass it over to Dr. Soutullo.
Wonderful. Thank you so much. I'm excited to share with you a little bit about some of our progress and updates since we met with you last at the Business of Pediatrics meeting. So in the meantime, if I click, hopefully we'll get, some graphics here. We have completed our needs assessment. So that was integrated into the annual practice survey that you all filled out as PHN member practices. We feel that that is one of our most important sources of data to better understand what your needs are and how we can be helpful with this behavioral health initiative. We also completed 2 different environmental scans. So an internal environmental scan talking to children's national leaders around what we're doing in integrated mental and behavioral health, and an external scan of other children's hospitals and clinically integrated networks to hear from peer leaders around what they're doing in that space. So we've completed that, which is great. We have some ongoing work in terms of developing practice and education support tools. I'm very excited to show you in a moment our brand new website that is live and ready for your use as a primary care provider. And our next step is really going to be to focus on proposing those innovative business models and care management solutions that we can pilot with you all, and excited to get to work with you all more as we are rolling those projects out. Great. So if you haven't seen it already, this is our brand new website. You can scan this QR code in order to access it, or you can go to the pediatrichealthnetwork.org. And if you click on events, there should be a button for the Behavioral Health Initiative. But this website has a collection of comprehensive and curated behavioral health resources that are really designed for primary care providers. So these resources were selected by our mental health experts on our team, and they're posted on the website. Everything on there is free to use and download for you in your practice. So we're very excited to roll this out. You may have seen it in the doctor's note email updates, and wanted to just make sure that you had this resource available for yourself and your practice. When you navigate to it, you'll see that there are a list of different topics. So we have 16 different topics posted. 2 of them are these cross-cutting topics around state and local resources, and then professional development practice toolkits. And then we have 14 different mental health related disorders or conditions that we have more detailed information about. So we're also really excited to be developing a corollary website to this that will be family facing, so that you can give patients and families a link where they can go to learn more about these different mental and behavioral health topics. So that is something we'll be pushing out this summer, and we'll be very excited to update you when that is ready. So in terms of what's next, we're going to be developing those specific priorities and activities, and then making these pilots available to you all. So one thing that we are very interested in is stakeholder feedback. So if you are here today and want to learn more, please do reach out to us via email, and we'll also be convening some regional and advisory stakeholder boards as well. Okay. So we do have a quick poll question before you go, so I'm going to pull up the poll, and then we want to hear from you around what are you doing in behavioral health care right now? What does your level of integration look like? Where do you want to be in the future? And then what's it going to take to get you there? So I'm going to pull up the poll so that you can pull it up on your phone so that you can take it, and then I'll show you this screen again and walk through what we're talking about with these different levels. So we'll give you a moment. If you don't mind, please indulge us and scan that QR code or go to that website there. You can also text to that link, and then once everyone has it pulled up, I'll pull the slide back up and then tell you a little bit more about what we're interested in learning from you. Right, looks like most folks have gotten it. I'll maybe wait just a few more seconds. Okay. So this is a model that was developed by SAMHSA, HRSA, and their Center for Integrated Health Solutions that details 6 different levels of collaboration that behavioral health providers and primary care providers might have. So you can see it runs from this continuum from level 1, where there's minimal collaboration, all the way up to level 6, full collaboration in an integrated or transformed practice. So we would like to understand, where do you feel like your practice is right now? That will be one of the first questions after some brief demo information. And then where do you want to see your practice in the future? So the first level is really more minimal collaboration. In this situation, primary care providers and behavioral health providers are in separate settings. They may communicate periodically, but there's really, it's driven by provider need, and they may never meet in person, very limited understanding of one another's roles. In level 2, basic collaboration at a distance, the providers are still in separate spaces, but they do communicate periodically about perhaps shared patients and do have a better sense of one another's roles, but really the collaboration stops there at the individual patient level. In levels 3 and 4, those are really characterized by providers of behavioral health and primary care being in the same space. Maybe they have some shared office space, but having a behavioral health provider in that same facility. In level 3, they'll have different systems, but do communicate regularly, and they may feel like you're part of a larger team, but in a less formal way. In level 4, that integration is a bit deeper. There are shared systems for scheduling and electronic medical records. They communicate in person as needed and do have an understanding of each other's culture and kind of a shared culture within that facility. Then in levels 5 and 6, these are really our integrated practice levels. So level 5 is close collaboration approaching an integrated practice. Here you not only have behavioral health and primary care providers in the same space, but there's also shared space. They're actively working together to develop joint solutions, communicating frequently in person, have team meetings, and have a really deep understanding of one another's culture and roles. And then finally at level 6, this is a fully transformed, merged, or integrated practice where you've really resolved most of those systems issues between the different professions. You're communicating consistently. You may have many more joint and shared visits between behavioral and mental health providers and your primary care providers. And you have a more blended kind of sense to your roles and culture. So again, we're very interested to understand, where do you feel like your practice is now, and where would you like to see yourself going in the future? This is not our only data point. We certainly have all that information I spoke about earlier that we've collected, and we'll also be at the exhibitor hall this afternoon if you'd like to stop by and chat more. But we're so grateful for your feedback, and if you have any specific ideas of what you would like to see or what you feel like you need to move from one level to another, we would love to hear that as well. So thank you so much for your time. I will turn it back over to Mark in terms of lunch. Thank you.
Couple things. One is when I started practice with my gray beard, there was no behavioral health. There was no obesity sort of thing. Everyone was just treating otitis, and things went great. The world has changed, and what we deal with right now is so much more challenging, demanding, rewarding. But, we're dealing with the real world now. Real kids, real families, much more challenging issues. It's great work. It's challenging work. We're thrilled that we're all here together as a group and sort of learning from each other. And that's the purpose of these meetings. And we hope to keep doing them for another 24 or 25 years.